This series, we will try our best to give you all the best possible must-read topics for upcoming INICET examination. Kindly update in the chat box. Is audio, video, everything fine? Can we start with the session? Very good evening, everyone. So I will try my best to give you all the must-read topic. The first, before starting this session, I will be giving you the list of 6 important topics. First of all, beta carcinoma larynx. This topic should be on your tips. Carcinoma larynx is one of the most important topic for your INICET Central Institute. Clear? The first important point which I am sharing with you, beta, is CA larynx, the first important concept. Then you should learn all the important concepts of audiometry. Like what is subjective audiometry, the first investigation, objective audiometry, the investigation of choice, what we have to do in conductive deafness, sensory deafness, dual deafness. Special important point on auto-acoustic emission. One MCQ always there on auto-acoustic emission. Is it clear? So audiometry is the mandatory topic, must-read topic. CA larynx have to be there. CSOM, complication of chronic suppurative otitis media. What is the most common surgery? Modified radical mastectomy. These points should be on your tips. All the students listening to me, let us use the next 45 minutes to learn the importance of these conceptual topics and how to crack these important topics. Clear? Then the one most important point they want, as a medico, you should be able to differentiate conductive deafness against sensory deafness. So what they will do, they will compare otosclerosis against Meniere's disease or acoustic neuroma. I hope you're getting my message clear. Otosclerosis against Meniere's or acoustic neuroma, one important point. Allergic rhinitis, very important concept. But in case of rhinology in nose, I have seen in the last 5 years what they are highlighting on the important blocks given in rhinology. So always remember important blocks: supraorbital block, infraorbital, anterior ethmoidal block. That is the most important point. I'm understandable. Special concern about VDN now. They can ask you something related with the VDN now. So blocks in rhinology, something to do with the rhinology, like they can ask you the INSEE and lateral anatomy and all these points. These are the 6 important must-read topics. If you open the last 3 years PYQ, it is somewhere around this management of CSOM, carcinoma larynx, audiometry, all these points. Clear? So these are the must-read topics. From here, let's start. Now let's start with the first important MCQ which I'm expecting. They will give you a yes beta, is Dr. Ayush beta, audio video is absolutely fine from our side. Kindly re-log in, rejoin. Now let's start the first MCQ. The man with 50-year-old. I always say, whenever there is an image given, always make a habit to see, to focus on the image first. Whenever there is an MCQ, they always give you a clue. The image is giving you something clue in the MCQ. 50-year-old, jump on the keywords. Make a habit of jumping on the keyword ear fullness, hearing loss in the right ear. 7 years later, the patient was having vertigo, means patient is having sensory deafness, having some hearing loss with vestibular symptoms. Clear? It means either my inner ear. What is suspected diagnosis? Either cochlear or retrocochlear. We can go for cochlear or retrocochlear. Clear? Is it clear? Now the examiner is giving you, audiometry is giving you moderate sensorineural hearing loss. Clear? Now 1 second, beta. I will just 1 second. Yes. Now is it fine? Is audio video fine, beta? Can you update in the chat box? Is audio video fine? Yes, is audio video fine? Now. Yes, beta. Dr. Ayush. Now I hope everything is fine. Audio video. Kindly update in the chat box. Is it fine now? Now this history, if I remove this image from the MCQ, the diagnosis going in the favor of. If I remove this image, it is typical Meniere's disease. Fullness of ear going in the favor of Meniere's disease. But examiner have given you a slide where examiner is showing you which type classification: Anthony type A, Anthony type B cells. I will go in the favor of ear acoustic neuroma. Which are the important keywords beta? Either examiner will give you eyes cone appearance, or examiner give you entry type A, entry type B cell, or examiner will give you roll over phenomena. Is it fine now? Kindly update beta. These are the three important words which are going in favor of your vestibular schwannomas. So answer will be option A. Again I am highlighting beta. If I remove the slide, answer going in the favor of Meniere's disease. Now let us rule out the option with the help of same slide, vestibular schwannoma, because these three words beta on this platform, revise with me. Antony A and B, eyes cone appearance, rollover phenomena. If given, it is going in the favor of vestibular schwannoma. What is the keyword? These are the important point. R for rollover phenomena. Which R is for sensory deafness? Absolutely beta. Thanks Ayush for the update beta. Our team have rectified now all the audio video, everything is going fine. Let's make this session interactive and everybody should reply. Every student should reply in the chat box. Meniere's. Which word should be there in the Meniere's? Examiner will give you typical history of fullness of ear. पेशेंट कहेगा मेरे कान में मुझे ऐसा लगता है कि कुछ भरा हुआ है, fullness of ear. Why? Because there is extra fluid in the endolymphatic sac. Which are recruitment phenomena beta? Every student sitting with me, let's revise. Rollover phenomena means neural deafness, means fatigability. What is recruitment phenomena? Over sensitivity beta. Central Institute, these things helps a lot. Rollover phenomena is equal to phenomena of fatigability. Recruitment phenomena of oversensitivity will go in the favor of Meniere's disease. Autosclerosis. Now which word in the MCQ will go in the favor of autosclerosis? They will either give you the option pregnant female or they will give you Carhart notch. Will go for autosclerosis. Then I am discussing 10 MCQs with you beta, and with the help of each choice I will be giving you the keyword for Central Institute. Now your Central Institute, they people want you should differentiate autosclerosis with the help of Carhart notch. What is the worth remembering point beta? 2000 Hertz bone conduction. This Carhart notch is in bone conduction, not in air conduction. But what they will ask you, the tympanogram of the patient after surgery. Which surgery? We are doing stepidotomy. So beta, if you do stepidotomy or stapedectomy after the surgery, which tympanogram will be there? Always remember AD. Beta, इस पे गलती नहीं करना. Autosclerosis have a tympanogram. Which tympanic membrane? Hypomobile tympanic membrane. But if the examiner give you after surgery beta, it will be AD graph. Am I understandable? Are you getting this point? This was one of the MCQ in the last year where they asked you the patient is suffering autosclerosis, is a bilateral condition. So we operated one ear. Now when we operated one ear, where will be Weber lateralized? Anybody who can write in the chat box. I am coming on the short sign beta. I will be cleaning all the doubts regarding Schwartz sign. Just tell me one thing. If I operate the patient, stepidotomy done on right ear, patient of autosclerosis, he will not mention bilateral. No, he will say autosclerosis. You have to conclude it is bilateral. You operated on the right side. Now tell me where will be Weber lateralized to. You tell me beta, Weber will be lateralized to. Yes beta, Weber lateralized to what's ear? Disease ear in bilateral conductive deafness. So Weber will be lateralized to left side. Are you getting this concept? I am repeating again, but after surgery, right ear operated means now right ear is normal, left ear is autosclerosis. So Weber will be lateralized to left side. Will be lateralized to left side after surgery. Is it clear? Yes, Dr. Garg, excellent. Dr. Ayush, great. It is poor ear, worse ear. Absolutely. That's the best part of live chat discussion. Everybody is responding. So these are the important points beta. They can show you eyes cone appearance of CP angle. Either they show you the entering classification or this. Dekho beta, concentrate on the board. Let's use this slide to crack the important point. If examiner show me something here, some abscess here, if the examiner is showing you some CSM patient with abscess, that will be temporal lobe abscess. If examiner show you some here empty delta sign, I will be going in the favor of Yes, you tell me empty delta sign, lateral sinus thrombosis, thrombophlebitis, and if examiners show me ice cone appearance, I will be going for acoustic neuroma. So if they want to make some integrated MCQ with ENT with radiology, these are the 3 important points, but never jump after seeing the word ice cone beta. Take my words, AIMS people can give you ice cone appearance of middle ear. What is ice cone appearance of middle ear? A nice beautiful ice cone formed by malleus and incus. So ice cone appearance of middle ear. Always remember, ice cone appearance of middle ear is normal. Ice cone appearance of CP angle is abnormal. Is it clear, beta? So this is first MCQ where I teach you how to differentiate your sensory against neural, cochlear against retrocochlear. Am I understandable? Clear? So I hope somewhere related with the stepedotomy, stapedectomy, or recruitment or rollover phenomena, these things they will be asking you. Done. Coming to the next one, very important concept where I will try my best to give you the vision of how to differentiate rehabilitation of deaf patient beta. So they can give you image-based MCQs. This is my implant. This is my bone anchored hearing aid, BAHA. Now, what is the indication of BAHA? Canal atresia, canal stenosis, pus in the canal. I can even use the high power BAHA in sensory deafness. So if the examiner is giving this word atresia, I will be directly jumping on bone anchored hearing aid. One important new concept which should be on your tips, most common complication of BAHA. So it is beta skin reaction to a metal of which this BAHA is made up of titanium. BAHA, most common complication is skin reaction to titanium. If examiners show you something this, it is related in the management of CSOM, that is your total ossicular replacement prosthesis. Total ossicular replacement prosthesis, and this is my stapes prosthesis. Am I understandable? Clear? They can show you this slide and they can ask you is related with. Now coming on this segment of implant, cochlear implant against brainstem implant. Always remember this plastic coat is external device beta. There is a internal device followed by a electrode. Now if examiner is showing you this electrode is the electrode array beta. This long electrode is going into the cochlea, into the scala tympani. Always remember this point. If I compare, there will be one MCQ related with these topics, but either they can ask you on hearing aid or they can ask you on the cochlear implant, brainstem implant. Favorite question, how you differentiate cochlear implant against brainstem implant. Always remember, cochlear implant is kept in scala tympani, kept via round window. MCQ number 1. Cochlear implant is kept in scala tympani, kept via round window. Brainstem implant is kept in lateral recess of fourth ventricle. Just remember this point, lateral recess of fourth ventricle. Important MCQ. Cochlear implant stimulates. What it stimulates? It will stimulate it now, while the brainstem implant will stimulate the next level, that is your cochlear nucleus in the brain. Cochlear nucleus in the brain. Important concept. Now concentrate on the board. Just learn one important point of cochlear implant. Most common indication is Mondini dysplasia. Mondini dysplasia is the most common indication. Michel aplasia is a contraindication. Now cochlea is absent. I can't use cochlear implant. So what I will be using in case of cochlear aplasia, Michel aplasia, brainstem implant. So they can ask you something related with management of Mondini dysplasia or management of Michel aplasia. Then now what the MCQ which was there in the last NEET exam, they have asked you something with this small electrode. Where is the arrow? If this same question is repeated, so beta this electrode, this small electrode, beta learn 2 words. Yes, Dr. Ayush, great. One is ground electrode or reference electrode. Beta दो नाम याद रखेंगे, ground electrode or reference electrode. Is it clear? So they can ask you something on the management part of it now. Auditory pathway, ECOLI, most important point. E. coli, This auditory pathway they have asked you multiple times, is must read topic, but I hope everybody knows the auditory pathway. So clear that. Now what is the importance of that this is something related with the rehabilitation, and use this platform. All the students who are listening me first time, you can ask, you can use the chat box for asking your query. Any point comes in your mind, you can ask here in the chat box. Clear. Coming to the question number 3, very favorite question of your सेंट्रल इंस्टीट्यूट, दे विल गिव यू ए हिस्ट्री ऑफ पॉन्ड्स. बेटा ये पॉन्ड्स को देखते ही टिक कर देंगे, क्या करेंगे, राइनोस्पोडियोसिस. राइनोस्पोडियोसिस, आई एम अंडरस्टैंडेबल. हियर इज द कीवर्ड mulberry like polyp. Can you appreciate mulberry like polyp coming from the nasal cavity? I always say P square. One, either they give you polyp, which polyp, mulberry like polyp, or they will give you ponds. हिस्ट्री ऑफ टेकिंग बाथ इन पॉन्ड्स, राइनोस्पोडियोसिस. वेरी सिंपल बेटा, एक सिंपल सा फंडा याद रखते हैं आज. इफ दे शो यू स्लाइड वेयर दे शो मिकुली सेल, दैट इज मैक्रोफेजेस, और रसल बॉडीज eosinophil, that will be rhinoscleroma. If they show you these big spores, diagnosis will be going in favor of rhinospodiosis. Am understandable? So let us crack. Now let us use this MCQ to learn the keywords. Rhinoscleroma. One day before the examination, rhinoscleroma is equal to woody nose. Just remember, woody nose, foul smelling crust formation. Foul smelling crust with merciful anosmia, that will be atrophic rhinitis. If they mention the word woody nose, go for rhinoscleroma related with Klebsiella. Am understandable? Which are the important keyword given by the examiner? Miculi cell, Russell bodies. Examiner can give you Hebra nose, beta. This is again a nodules on the nose, Hebra nose, or they can ask you tapered nose, Hebra nose. All they are related with rhinoscleroma, common in northern part of the country. If examiner give you some MCQ related with rhinospodiosis, mulberry like polyps, or they can give you a typical history of taking bath in the ponds. A typical point, the most important point which we have to consider in the management. You tell me, beta, surgery, everybody knows surgery is the treatment, surgical excision, but what is the keyword? Keyword, always remember cautery at the base, beta. It bleed a lot. Because it bleed, we have to do cautery at the base. Is it clear? Angiofibroma, unilateral, आना beta, unilateral epistaxis, young boy, frog face deformity, Holman-Miller sign, that is posterior wall of maxillary sinus bending down. That is a keyword for angiofibroma. They can ask you on the fish classification related with the angiofibroma. Clear? Nasal polyp, pearly white mass, very important topic, beta, because nasal polyp is you can say is common presentation in the OPD. So they can ask you. Yes, one of the student, doctor. Yes, beta, very good. Dapsone can be used as a drug to reduce the chance of reoccurrence. Very true. Nasal polyps, again important topic for Central Institute. They can either ask you cartilaginous syndrome or Young syndrome, that is your azoospermia, dextrocardia, it is your cartilaginous syndrome. They can ask you something on the sensitivity of aspirin, samstrostride. These are the important point. Just remember one key point. Nasal polyp, ethmoidal polyp, enteroconal polyp. Ethmoidal polyps, reoccurrence is common. We use anti-allergic steroid. Why? Because it is related with allergy. Enteroconal polyp, no, not related with allergy. So reoccurrence is very rare. These are the 3 important slides. Rhinophyma. This is rhinophyma. This is my ulcerative lesion. Rhinoscleroma, and if a mulberry like polyp is coming out, we go in the favor of rhinospodiosis. Am understandable? History of taking bath in the ponds, important in rhinospodiosis. Question number 4. All of the following diseases are associated with a given tympanogram. First of all, which tympanogram is there? Now I will be just discussing 2 important points. Clear? No, beta, Meenakshi, no. Now concentrate on the board. This is your hypomobile or hypermobile. Hypomobile. This is my normal movement. This is my AD type of tympanogram. All the tympanograms, very favorite topic of your Central Institute, or AS. This is AS. Hypo is seen in otosclerosis, tympanosclerosis, tympanofibrosis, but not in ossicular disruption. Ossicular disruption, beta, which graph? AD graph will be seen. Now let's crack this question in a different way. If you can't identify this graph, beta, if you can't identify this graph, no worries, rule out the option. I always say to my students, beta, use your common sense. Odd man out. If I go with the rule of odd man outs in my lecture, I always discuss few important tricks. Beta, tukka marenge, but that tukka should be educated tukka. Some logic should be there. So out of 4 option, otosclerosis, tympanosclerosis, otofibrosis, they seem to be on one side. Ossicular disruption, odd man out. This helps a lot. It helps you to crack 1 or 2 MCQs. Don't feel here 20-30 MCQs will be cracked. No, it can help you in 1 MCQ in odd man out theory. So just rule out one option. Clear? So answer will be A. Let's use, this is your AS tympanogram. These are the important points related. I will be discussing all the tympanograms, no worries. Clear? Now examiner can ask you something on pure tone audiometry. This is your airborne gap seen in feature of conductive deafness. This can be a feature of sensory neural deafness when there is no airborne gap. Moderate to severe deafness, clear. Then we are going with the pure tone audiometry, Carhart notch, bone conduction. One, they can ask you something on noise induced trauma, beta. I have 9 important pure tone audiograms from where they will pick one. Clear? So one is your normal, one is conductive, one is sensory neural, one is Carhart notch, one is noise induced trauma. Noise induced trauma. What is the guidelines? WHO say in any industry sound should not be more than 85 decibel. Indian Factory Act, they say it is 90 decibel. But if examiner asks you something about city life, maximum is 45 decibel. These are the important points. Noise induced trauma. Very favorite question, beta. I am expecting in the upcoming examination, either they give you rising curve. This is low frequency hearing loss, a feature of Meniere's disease, or they can give you this type of down sloping graph coming down. This high frequency hearing loss is a feature of old age related presbycusis. Clear? So these are the important points. Sometimes they can ask you U-shaped audiogram. That is a feature of congenital deafness. C for congenital, C for CMV. These are the important points. Better revise with me. Normal, conductive, sensory neural, 2000 Hz loss, 4000 Hz, low frequency hearing loss, high frequency hearing loss, and congenital deafness. Congenital deafness. Is it clear? Crystal clear. Then coming on BERA, brainstem evoke response audiometry, BE BERA, also known as auditory brainstem response, beta. ECOLI, ECOLI. Wave 1, wave 2 is for this one. The last 2 wave 6 and 7 is for inferior colliculus. The wave 3 is for cochlear nucleus, wave 4 for olivary, wave 5 for lateral lemniscus. It cannot diagnose higher cortical deafness, beta. It can only diagnose up to E. coli. For the higher cortical deafness, we use SERA, cortical evoked response audiometry. OAE, auto-acoustic emission, important topic, beta, is used for screening in newborn. It should be done in all the newborn. It should be done on first day. Should be definitely done by first month. And it should be combined with BERA. It should be combined with BERA in high risk baby by 3rd month. याद रखेंगे बेटा, इस concept को build up करते हैं. Auto-acoustic emission in all newborns, but BERA in high risk baby. Important MCQ. What is the importance of 6 months? Anybody who can write in the chat box. Importance of 6 months for upcoming Central Institute. 6 months, beta. We have to treat the newborn by 6 months to avoid mild development of language. We have to do. Now, last year, 2023, they have asked you a nice concept, OAE negative. What to do? This was a nice concept. Now learn this concept, beta. If auto-acoustic emission is negative, what are the possibility? Auto-acoustic emission can be negative in 3 conditions. Either cochlea is absent, cochlea is negative. If cochlea is negative, definitely cochlea abnormal, sensory deafness, auto-acoustic emission will be abnormal. Or It can be even absent in normal cochlea. Sometimes the cochlea is normal, but OAE absent. This is the big drawback of autoacoustic emission. These are the emission by outer hair cell. Or autoacoustic emission, one of the big drawback. Dr. Garg, excellent. What is the third important drawback? This autoacoustic emission can be blocked by middle ear pathology. And if middle ear pathology is there, we will go for which investigation? Beta, aap batayenge. Middle ear pathology, we go for impedance audiometry, tympanometry. Impedance, that is tympanometry. So the MCQ which was there in your NEET last to last INICET, that was autoacoustic emission absent, will be going for tympanometry. Treatment should be done, beta, that is treatment should be done by 6 months to avoid maldevelopment of language. Done, clear. Coming on the question number 5, allergic fungal rhinosinusitis. Very important point. This question repeated twice. I'm expecting this year they will ask you something related with allergic fungal rhinosinusitis. Like last, they ask you allergic sinusitis. Clear. They have given some sign of depression and they ask which of the following is not defining of allergic sinusitis. This year, I'm expecting they will ask you something on allergic fungal rhinosinusitis. What are the 2 keyword? But for allergic fungal rhinosinusitis, just remember the keyword. One is your peanut butter like mucus, and one is heterogeneous opacity. So next time when you enjoy peanut butter, better revise one topic for me: allergic fungal rhinosinusitis. Done. Allergic fungal rhinosinusitis. Clear. So just remember this point: peanut butter with heterogeneous opacity. Can you see? Beta, this is homogeneous, one density, black. This is homogeneous, but here you can see white lines. What are these white lines? These white lines are fungal elements. Because they are fungal elements, we call it as double density, that is heterogeneous opacity with peanut butter. Just remember these 2 keywords. They can ask you one criteria, that is Bent's criteria, BENT. In Bent's criteria, allergic fungal is a minor, not a major criteria. Is a minor, not a major criteria. Is it clear? Done. Allergic fungal rhinosinusitis is again an important topic. All these criteria, Bent's criteria, should be on your tips. Very good, Dr. Deepan. Fungal smear is a major and fungal culture is a minor. Please highlight this point. All these are the important point. Answer will be fungal culture will be minor. Dr. Om Prakash, beta, fungal culture is a minor, not a major. Is it clear? Coming to the next one, question number 6. Examiner can give you, dekho beta, examiner have 3 options. Either they can ask you laryngomalacia, or congenital webs, or subglottic stenosis. So they can ask you this type of slide. They will give you something below the vocal cord. If something is below the vocal cord, this is your subglottic stenosis. हम क्या कहते हैं मेरा? Subglottic stenosis. It will be which classification? Cotton-Mayer classification. Congenital webs, Cohen's classification. That is for webs. Just remember this point. COHEN, Cohen's classification, is for webs. Cotton-Mayer classification is for your subglottic stenosis. In Central Institute, they can ask you the definition. Subglottic stenosis defined as less than 3 mm or defined as less than 4 mm. So just remember, subglottic diameter less than 3 mm is a definition in preterm baby beta. It is in definition in preterm baby. Less than 4 mm is the definition in full term baby. Just remember this point. Preterm. Clear? Now I'm giving you an important concept beta. This on this platform we are sharing. This was the last NEET question, which was directly from your workbook. Subglottic stenosis is most common site of congenital stenosis is subglottic area. Now concentrate. How we define congenital stenosis against congenital webs and laryngomalacia. Laryngomalacia supraglottic. Just remember, if it is supraglottic, we will be having inspiratory dyspnea beta. Just remember the keyword. If examiner mentioned the word inspiratory dyspnea, I will go for supraglottic. Done. Glottic area will be having biphasic, like the examiner makes some MCQ on webs. Webs is your glottic area. Will be having biphasic dyspnea. Difficulty in breathing during inspiration as well as expiration, biphasic. But in glottic area, there will be a typical symptom of hoarseness. There will be typical symptom of change in voice. Hoarseness will be there. If examiner gave you a history of abnormal cry now in a newborn, how can you judge कि cry is a hoarseness or no? Hoarseness will help of cry. But in subglottic area, when the subglottic area is involved, it is below the glottic area. It is biphasic dyspnea, but normal cry. Just remember, beta, it will be normal cry. That normal cry because it is subglottic area. Not expiratory, beta. It is biphasic. Just remember, glottic area, subglottic area, and cervical trachea. They are going in the favor of biphasic dyspnea. Then Cotton-Mayer classification, very favorite. Less than 50% grade 1, 51 to 70 grade 2, 71 to 99 is grade 3, and total is grade 4. Just remember this point. Treatment, surgical excision with re-anastomosis. Done. In context of dyspnea, again beta, tracheostomy, very important topic. Most common tube we are using is cuff tube. This is uncuffed tube, we never use. This is fenestrated tube. They can ask you, it is used for voice beta. For Central Institute, two favorite choices. After how many days proper track is formed? Always remember, track is formed after 7 to 10 days beta. Track is formed after 7 to 10 days. That have you put the tracheostomy tube? Track will be formed after 7 to 10 days. Dead space is reduced by 30 to 50%. High level tracheostomy is for malignancy. Low level tracheostomy is for infection having a high risk of dissemination like diphtheria. High level tracheostomy is for malignancy. Low level is for diphtheria. One of the students is asking me what is inspiratory dyspnea. Dyspnea more during inspiration. So whenever there is a supraglottic involvement, when the upper part is involved, it will fall more during inspiration. So inspiratory dyspnea. Examiner can ask you an important concept of electrolarynx beta. If the examiner show you this slide and they ask you which surgery was done in this patient. So this patient, tracheostomy tube is there, with he's holding some device. Electrolarynx. This is electrolarynx used for vocal rehabilitation. So the very favorite question. They can even ask you, they can show you something like this, which surgery is being done. This is again total laryngectomy. Just your basic anatomy, your line diagram should be, you should be the master of line diagram. On the anterior wall of trachea, we put tracheostomy tube. On the posterior wall of trachea, we put a tracheoesophageal prosthesis. Is it clear? So again I am repeating beta, this is my trachea. On the ante wall, tracheostomy tube. On the posterior wall, there will be tracheoesophageal prosthesis. On the ante wall, tracheostomy tube. On the posterior wall, tracheoesophageal prosthesis. Done. This is your Blom-Singer tracheoesophageal prosthesis. They can show you something, FMGE voice button. They can show you this slide and you ask you where we are using. It is used after total laryngectomy. Clear? They can even ask you an important concept of polite yawning. Very important point in Central Institute. Polite yawning is yawning with closed mouth. Yawning with closed mouth, used for olfactory refunctioning. Used for olfactory refunction. Is it clear, beta? Is this concept clear? I'm trying my best on this platform to touch you all the expected slides, all the expected important topics for the upcoming examination. Question number 7. 5-year-old child complaining of hearing loss. Now I will use this MCQ to teach you how to make the differential diagnosis, how to focus on the keyword. What is the keyword in this MCQ? Two important points. 5-year, that is pediatric patient with chalky white mass. 5-year-old child with chalky white. Very good evening, beta. Everyone concentrate on all the concepts we are discussing. 5-year chalky white mass behind intact tympanic membrane as shown in the image. Examiner have shown you something chalky white mass. Now if there is a chalky white mass, now concentrate on the board. Examiner is giving a pediatric patient. We will go in the favor of congenital cholesterol. Just always remember, if we are examiner is giving you chalky white mass in pediatric patient, congenital. If there is a retracted tympanic membrane with no ear discharge, retracted tympanic membrane, no ear discharge, I all go in the favor of, if examiner mentioned the word retracted tympanic membrane, primary cholesterol, no ear discharge, only tympanic membrane retracted, especially in the paraflacella area, it is your primary cholesterol. If examiner mentioned ear discharge with perforation with a long-standing infection, we go in the favor of secondary cholesterol. We go in the favor of secondary cholesterol. Clear? All the hypotheses related with the primary, secondary should be on your tips beta. Levinson criteria is used for congenital cholesterol. Very important. They can ask you which criteria is used for congenital cholesterol. If examiner give you a typical history, very good, Dr. Himanshu, excellent. With a history of trauma, if examiner mention the history of trauma, surgical trauma, roadside accident, any trauma, it is going in the favor of tertiary cholesterol. It is going in the favor of tertiary cholesterol. Is it clear? Done. So right answer on this MCQ will be your congenital cholesterol. Now let us rule out other options. Automycosis, fungal infection, aspergillosis niger. In the ear, automycosis is aspergillosis niger. Typical appearance. Can any student who can write in the chat box, beta, which appearance will be there? Which appearance in automycosis? Just remember, automycosis, which appearance? Wet newspaper like black spot, white spot, black spot, white spot. That is your wet newspaper like appearance. If examiner give you that type of finding, automycosis. Pregnant female, bilateral condition, Schwartz sign, red tympanic membrane, it is otosclerosis, or they will give you some tympanogram, AS tympanogram, otosclerosis. Anyone who can write what is the other name of exosteosis? Exosteosis, that is your bilateral. Exosteosis is your, yes, bilateral. Exosteosis, bilateral osteoma formation, it is surfer ear. We call it as surfer ear. Dr. Himanshu, you have updated newspaper like appearance, not wet newspaper like appearance. Clear? So it is surfer ear. Exosteosis, commonly seen in swimmers. Clear? Surfing on the beaches, air or the wind will cause trauma, will be a precipitating factor for osteoma formation. Osteoma, beta, very important point. Either they can ask you in the external auditory canal, or they can show you a HRCT where they are showing something opacity in the frontal area. Osteoma is the most common benign tumor of external auditory canal as well as frontal sinus. Am I understandable? So they can ask you either in frontal sinus or in the external auditory canal. Done. Coming to the next one, this is a favorite question of your Central Institute. Comment on the block beta. They will give you a few blocks. This is anterior ethmoidal. I am showing you all these slides. Beta, isme galti mat karna. This is anterior ethmoidal, also known as nasociliary block. Nasociliary block. Clear? Then coming on, this answer will be here. It will be B option. Coming to the next one, if examiner show you something, this is your dorsal nasal block, which we have already discussed, given in the MCQ. It is also known as anterior ethmoidal nasociliary block. Dorsal block, anterior ethmoidal block, or nasociliary block. Is it clear? If examiner show you some this slide like this is supraorbital or supratrochlear beta. Photogenic memory, these images will help you in the examination hall. Supraorbital or supratrochlear block, very important. They can ask you something about infraorbital block. Now I am comparing two important blocks. One is supraorbital, one is infratrochlear. Just upper part of the middle canthus, can you see? This is your infratrochlear block. infratracheal. So all these blocks should be on your tips. Now concentrate. I will take any one slide. I will try my best to give you some important concepts of, beta dekho, concentrate. If examiner give you, one second. Yeah, if examiner give you a incision on septum, or inside the septum, if I'm giving incision on one side, it is septoplasty. Is it clear? If examiner give you incision on both sides, it is SMR, submucous resection. Inside the nose, on the septum, if I'm giving on one side, it is septoplasty, on both sides SMR. And if examiner give you incision on this area, columella, and we are elevating the flap so that we can do the cosmetic surgery rhinoplasty. So if it is on the skin, like in the last NEET, they have asked you incision on the this end, anterior end, on the columella part, we will call it as rhinoplasty. Done. If examiner give you the incision along the lateral surface of nose, this is known as lateral rhinotomy incision, used in nasal malignancy. What is the other name of lateral rhinotomy incision? Anybody? Moore's incision, also known as Moore's incision. Or they can ask you something on maxillary sinus incision. If we are giving the incision on the maxillary sinus, that is known as Weber-Ferguson incision. Clear? So these are the important points. This is something to do with nasolacrimal duct patency. All these are the important points they can ask you in the examination. That nasal bone fracture, most common fracture. On trauma, expect one MCQ. Either they will ask you something on nasal trauma, facial trauma, or they can ask you something on skull fractures. Very important. Skull, head and neck tumors, important. Most common facial bone fracture, nasal bone. Second most common fracture is zygomatic fracture. That zygomatic fracture. As far as skull fractures are concerned, if the fracture is somewhere temporoparietal, this area, external ear, middle ear damage, that is longitudinal fracture. And if somebody hit you from behind, that is occipitofrontal trauma, that is your transverse fracture. But these are the two important points for skull fracture. Longitudinal fracture are common, transverse fracture less common. They are temporoparietal, longitudinal, and transverse occipitofrontal. CSF in the middle ear present in the longitudinal. Tympanic membrane, because your external ear, middle ear damage. Beta, इस concept को सीखना है. This is external ear, middle ear damage, while in transverse your inner ear is damaged. So here there is less possibility. Facial palsy will be delayed in onset in longitudinal, while it will be in immediate in case of transverse. Hearing loss here will be conductive. Here it will be sensory neural. In CSF atoria, again it will present in your longitudinal, not in transverse fracture. Done. Battle sign ecchymosis over the mastoid, very important for Central Institute. They ask you something on trauma, where either they ask you facial fracture, zygomatic fracture, or leaf foot or skull fracture. So expect one MCQ on the trauma part. Done. Let's discuss one important PYQ. Nothing can be more easier than this here. 7-year-old child, examiner is giving you sensory neural deafness. Which of the following will not be a part of management? I always say INICET Central Institute paper is very conceptual. This is a golden opportunity for those students who couldn't perform well in the last NEET exam. Paper was atypical. Upcoming examination will be conceptual. Take my word, beta. This was the question in last exam. Patient suffering from sensory neural, which is not a part of management. बेटा इससे इजी कोई नहीं पूछ सकता ना बेटा. सेंसरी डेफनेस है, क्लास अकोमोडेशन. वी विल आस्क द टीचर द classroom the child should be on the front row, not on the back. Cochlear implant will be the treatment of choice. Hearing aid can be used as a first line of treatment. Grommet insertion with adenoidectomy is a treatment for conductive. It is a treatment for conductive, not sensory neural. I appreciate the examiner who made this question. Each and every concept crystal clear. He asked you grommet insertion, conductive, sensory, rest of the management. The answer no beta, it is not B, it will be A. Grommet and adenoid surgery is something to do with your conductive deafness. Coming on the next one, female tinnitus, hearing loss, episodic vertigo. With examiner is giving you some PTA choose the most appropriate. This is already we have discussed beta. This is going up, rising Meniere's disease, endolymphatic hydrops. They can ask you on the management part of Meniere's. So just remember two important conditions. One is your malignant otitis externa, that is diabetic patient, pseudomonas in the external ear, malignant otitis externa, and Meniere's. The treatment of choice is medical treatment. Low salt diet, we give labyrinthine sedatives. Auditory physiotherapy, I can ask you a question, study the following slide and which will be the next treatment option if the patient is not responding to medical treatment. So physiotherapy, which physiotherapy? Positive pressure therapy, we give positive pressure therapy. Then acoustic neuroma, already we have discussed. Cochlear otosclerosis, very rare phenomena. We see a double density on the HRCT or cookie bite audiogram. These are the important points related with cochlear otosclerosis. Done. Clear? So these were the important topics. I tried my best to give you the vision how to proceed. All these 10 MCQs were taken from the last previous year question bank of Central Institute, and each and every question is doable beta. And I will again give you a message to do doable MCQs. The game is of your confidence beta. Don't quit the game even if you couldn't perform well in the last NEET exam. No worries beta. Paper was atypical. You may perform, you may get a top rank in the upcoming examination beta. We have seen many students who couldn't score good rank in the NEET exam, but in the next INICET they come in the top ranks beta. Be confident. Revise the concepts in the last spell. Don't go with the quantity कि मैं ये भी पढ़ लूँ वो भी पढ़ लूँ. Not practically possible beta. Just whatever notes you have made, just revise them. Try your best beta. Try your best to do at least 2 or 3 revision before the examination. DVT, I will recommend you beta. Don't miss all the important sessions of DVT. And this year we are conducting DVT face to face in 6 different areas of the country. And try your best to attend each and every session. Try to revise DVT nicely, and take my words beta, it is very easy to prove your excellence in the upcoming examination. Just have faith on you, work hard. Any query related with ENT, any concept where you are feeling difficult, anything you want me to teach, how to concise the notes, you just inbox me on Insta or Telegram. Thanks a lot for listening to me. We stop at this. Best wishes beta, best wishes, and we are waiting for your interview. Just go crack the exam, come with the flying colors, and just give your best performance in the upcoming, irrespective of what rank you got in the last NEET. Best wishes. Best wishes.